Hey, this is Dr. James McKinney here at Blue Mountain Wellness. I'm one of the chiropractors, and I'm here with our physician assistant, John Reel. And today we got something really special to talk about. We're really excited about this. This is PRP. And John, let's have you take it away and tell us what is PRP?
Well, hello everyone and welcome to the PRP podcast. PRP is a way for the body to naturally heal itself. Your body has a remarkable ability to heal itself. And PRP utilizes one of the cells in the blood called platelets that are sent to an area of injury or damaged tissue in the body. When those platelets arrive, during a natural healing process, they trigger some other growth factors and other things like enzymes and minerals and nutrients to begin the healing process. And what we can do through PRP is we can concentrate these platelets and draw them off after spinning them down and separating them in a centrifuge and inject them back into the damaged or injured body part. And that starts a small inflammatory process which starts the regeneration and healing cascade. In fact, it can really supercharge the body's own ability to heal itself.
That's wonderful. So one of the questions that I get asked quite frequently is PRP safe? And what are the risks associated with PRP?
PRP is very safe because we're using your own blood. We're using your own serum and plasma. And even though it's injected back into yourself, there's a very low possibility that your body's immune system will reject that. The only downside sometimes is that in order to generate the healing process and the regeneration process using PRP, we do start a small inflammatory process, and you can get just a little bit of achiness and pain in the first 1 to 3 days, sometimes up to a week, but that's what we want. That small inflammatory mechanism starts the regeneration and healing process in the injured or damaged tissue.
That's wonderful. So another question I get asked is, what areas are you able to treat with PRP?
Well, that's the wonderful thing about PRP. You can treat all areas. You can do joints, you can do soft tissue, tendons, ligaments, cartilage. Basically, anywhere that there's injury or damage in the body, you can use PRP for regeneration and healing.
Awesome. So if there's a patient comes in and there's more than one area that's damaged or inflamed, how many places can you treat with PRP?
The recommendation is that you do 2 areas. For example, if we're doing both knees, you could do both knees on that same day. But if you were doing an additional joint or body area, for that patient, you would want to wait anywhere from 2 to 4 weeks to do that. But the nice thing is you can do more than 2 joints. A lot of times we'll stagger it to different appointments to make sure that initial inflammatory response, doesn't cause increased pain for the patient.
Wonderful. And how often should we be doing the treatments? How frequently do they have to do it? Is it one time? Is it more than once?
It's recommended that we do 3 different shots, and the shots can be separated by a variety of intervals in shot. Mostly it's 2 to 4 weeks, for the best healing to take place from that initial inflammatory response that we were talking about. But the amount of shots you can have and the times you can have them are not restricted.
Okay, great. So you said 2 to 4 weeks, and is that how long it should take to feel something, or how long does it take to start to feel the results?
Most people from our experience give us feedback that about 2 weeks after the second set of shots. So if you're giving a set of 3 shots 2 weeks apart, it's about at the 1 month to 6 week period when they really tell us they noticed a difference.
Wonderful. Do you have any feedback on how effective it is, by and large, blanket statement for efficacy?
Yes, there's been some studies done in the country, large double-blind studies that show that up to 92% of all people who receive PRP injections for treatment get at least some benefit, okay? So that's a very high percentage. And PRP can heal damaged or injured tissue 50% faster than some of the other modalities like long-term medication or even surgery.
That's incredible. And is there any side effects to it then?
Not specific side effects. There are some limitations. We mentioned the small inflammatory response at the beginning, which triggers the healing and regeneration. That can last anywhere from 3 days up to 1 to 2 weeks. There are some people who really shouldn't have PRP, though they're restricted. And those are people who have an active infection, or they have HIV/AIDS, hepatitis C, or someone who's receiving chemotherapy within the last year. It's contraindicated in those patients.
Got it. Okay. And then as far as, regenerative medicine as a whole, is there any alternatives to PRP?
Yes, the alternatives are some that we already mentioned: long-term medication therapy, surgery, and also physical therapy. Sometimes bracing is used on the front end before PRP is actually done. Those are some of the alternatives.
Okay, great. And PRP, it's becoming more of a buzzword in the wellness space. But how long has PRP been a treatment solution?
That's a very interesting question. A lot of people don't realize that the first ideas to use PRP came from scientists who were investigating slowly healing fractures and skeletal injury back in the early to mid 70s. Now, in 1999, on the West Coast, PRP was first used for damaged or injured tissue like joints, tendinopathy, acute tendon rupture, bruises, lacerations. That was 1999. And the first PRP that was used for hair regeneration or hair growth was in 2006.
That's wonderful. Mm-hmm. Yeah. So, and we have these conversations quite frequently in the clinic, and one of the questions I get from patients after they hear about all this is, why hasn't anybody told me about this before?
Yeah, I get that a lot too when I'm in the room and about to do the injections. It's just because PRP is not one of the more common modalities or therapies that are offered by providers like orthopedic surgeons or physiatrists or family doctors. It's mostly medication or an injection other than PRP, like a cortisone shot or a Toradol shot or physical therapy. But PRP is now being picked up, in many, many parts of the country by orthopedic surgery and physiatry practice groups as a primary therapy. So it used to be very secondary in thought and recommendation, but now it's starting to get its place.
Wonderful. All right, so let me throw you a scenario. Patient comes in
Mm-hmm.
and they say that their knee is bone on bone.
Mm-hmm.
Is PRP still something a viable option, or what other options do they have?
Yes, as we know from studies, and we both know that most people who are bone on bone with knee arthritis have collapse or loss of joint space on the medial side, but they have preserved joint space on the lateral side and the middle part of the joint. PRP is still beneficial for those people because of that bone on bone situation on the medial side of the joint. They have erosion, they have pain, they have inflammation, they have swelling, and the PRP can be used not only to heal that problem on the medial side, but also to preserve what cartilage and joint lining they have on the lateral side of the knee.
Great. And then what about cortisone? That's something that seems to be a cheap option, and people do it. Well, how does that compare to PRP?
The real difference is, and also just to let our viewers know that when people come in for a consult to talk initially about PRP and their interest, we do offer them the other types of injections, like nerve blocks, like trigger points, like cortisone injections. Cortisone injections are more short-lived. They involve using a medication like Novocaine or lidocaine for immediate pain relief, but that's gone away just like it is in the dentist's office in 2 to 4 hours. And then the steroid part of the cortisone shot, usually triamcinolone or Kenalog, kicks in the first 24 hours and can give you longer relief up to 2 to 6 weeks. PRP lasts initially up to 6 to 9 months and can last in some patients who have less severe disease between 20 and 24 months before it has to be repeated.
Okay, so with PRP, it's not an immediate relief like cortisone.
No, it's not an immediate relief. It's more long-term. As we were mentioning before, most people see the initial benefit in 2 to 6 weeks, and then it can last for months.
Wonderful. Mm-hmm. What about somebody with, shoulder pain or maybe a tear or something? Would PRP be helpful for that?
Yeah, that's the real benefit of PRP. Not only can it be used in many body areas like tendons, ligaments, joints, and soft tissue, but we can do really any joint, any tendon, any ligament. So necks can be done, lower backs can be done, shoulders, elbows, wrists, wherever there's a joint space or a tendon or ligament or soft tissue that has damage or injury.
So John, thank you for going over PRP. If this is something that might be of interest to you, right now we're offering a special where you can come in, you can do a consultation, we'll take some images with an x-ray, and then we'll do a pulse wave treatment, all for just $49. And hopefully we can help you out with this PRP regenerative medicine here at Blue Mountain Wellness.
I look forward to talking with you soon.